we told you if Connecticut Independent Senator Joe Lieberman got onto the topic of health care, we'd take you there. He is, and we are.
Is out, and there's no other attempts to bring things like that in, then I'm going to be in a position where I can say, I'm getting to that position where I can say what I've wanted to say all along, that I'm ready to vote for health care reform. My whole point has been here that the president laid out a couple of big goals for this process. Bend the cost curve down for individuals, families, businesses, our government, our economy of health care. And secondly, bring a lot of people in who can't afford health insurance now. The basic core bill does that. I think some of the other things we're going to add to our debt, increase taxes, and were just not necessary to achieve those two goals. So I think we're heading in the right direction.
You've got a lot of insurance companies in your state. How much pressure, if any, have you been getting?
I thought you said you were going to be reverent.
I'm trying.
I haven't received any pressure from the insurance companies. I mean it. Periodically, they'll talk to my staff about one thing or another, but I'm taking these positions. I've never hesitated to take on the insurance companies.
Can you
hold on? And so I'm just, the reason I was against the public option is the same reason that a lot of people are worried about this overall health care reform proposal, which is that they think it's getting too big, and they worry that it's going to increase their taxes and increase the national debt that their kids and grandkids are going to have to pay. So that's why I was
Can you explain your comments on the Medicare buy-in?
Well, I didn't change my mind on the Medicare buy-in. I mean, I know this is a classic sort of sport here. Although it's not terrible to change one's mind if in fact you do. But I don't want to spend too much time on this. In the 2000 campaign, when I was privileged to be Al Gore's running mate, the party platform was to suggest one way to reform health care was to allow 55 to 65-year-olds to buy into Medicare. That's a very stressed age group when you don't have insurance. But a lot of things have changed in the 9 years. First is that 2000, the federal government was in surplus and paying off the debt, not having increased the debt enormously. Secondly, Medicare wasn't on the verge of imminent bankruptcy, which it is now. And third, there wasn't a bill on the floor, such as the one on the floor now, that would extend very generous subsidies to those 55 and 65-year-olds to enable them to buy insurance and reduce the impact of age in the pricing of insurance policies. So things changed a lot.
More recently,
oh, in the Connecticut Post interview, well, I finally got to see that on TV last night, and it looked to me like I was referring back to things I had supported in the past to make the point that though I was against the public option, I was not against health care reform. And of course, I did that before the Finance Committee bill came out with this very large, and again I'd say generous, but I support it, system of subsidies to bring basically lower middle income people into the health insurance system.
But Senator, weren't those subsidies baked into the health care reform architecture long before that?
Not to that extent. But look, here's the point. The Medicare buy-in as proposed didn't make sense. I mean, you can all focus on it, but it ended up, it seems to me, when advocates of the public option saw that they didn't have the votes for the public option, they kind of tried to get it down another path. And it made no sense. Hospitals, incidentally, I'm not the only person in the Democratic caucus who opposed the Medicare buy-in. You saw that 11 other Democratic senators wrote to Senator Reid telling him they were against it because of the impact they thought it would have on hospitals and doctors in their state, and by cost shifting on the 180 million people in America who get their insurance today through private companies. Their premiums would go up. So that's where we are now. This was unnecessary. The fact is that the more they try to sort of change it to get it through, separate insurance pools, separate from Medicare, self-sustaining, the premiums would have to pay for it. As I said to one of the advocates of it, nobody between 55 and 65 is going to be able to afford this plan. And he said to me, that's not the point. We're trying to work out a deal here. So I said, well, that doesn't make any sense to me, because in the long term, the danger will be that the federal government will be pressured to take this over, make up deficits in this separate pool. And again, it's not necessary. We've got a great health insurance reform bill here. And the danger was that some of my colleagues, I think, were just trying to load it up with too much. And what happens then is that you run the risk of losing everything. So I think what's beginning to emerge, though I know some people are not happy about it, is really a historic achievement. Healthcare reform such as we've not seen in this country for decades.
Senator, are you surprised how Senator